Good afternoon. I'm here to provide an update to Albertans on the progress that we're making on the distribution of the COVID-19 vaccine and to announce that we are expanding distribution to vaccinate more healthcare workers. In many ways, Alberta is better positioned than any other part of Canada with respect to the vaccine, to get it into the arms of as many people as fast as possible. And that's because, in part, we have a single health authority with networks across the province. We also have, of course, some of the best healthcare professionals in Canada and the world helping to lead this effort. And we've had a dedicated team preparing for months to ensure that once vaccines have arrived, that we are ready to administer them. Now, as of yesterday, we have administered a total of 46,791 doses of the Pfizer and Moderna vaccine to long-term care residents, respiratory therapists, ICU nurses and doctors, and other frontline healthcare workers. So we should be clicking past 50,000 doses administered by the end of today. We've used more than 3/4 of the vaccine doses in our stock. That's the second highest amongst major Canadian provinces in Canada. We've increased our daily vaccination administrations from an average of 878 in December to an average of more than 3,800 per day in early January. Every day we are taking steps to improve our vaccination campaign and expand eligibility for priority groups. The teams at Alberta Health Services, Alberta Health, and the COVID-19 Vaccine Task Force have proven to Albertans their ability to adapt, to pivot, and to ramp up quickly. We've made significant progress in long-term care and designated supported living facilities, with 398 facilities in the process of receiving the vaccine. And Alberta is on track to complete vaccinating long-term care and designated supported living residents in all health zones by the week of January 18th, that is to say, next week. In fact, the North Zone will complete its vaccinations of their residents by the end of the day today. This is very good news because, of course, these are amongst the most vulnerable people to COVID-19, and we are within days of having completed the first dose for those particularly vulnerable seniors. There are three critical components to our continued success. First, we must have the staff and resource capacity to deliver the vaccine. Now, as I mentioned, I'm pleased with the ramp up that Alberta has demonstrated in this area, but this will be an ongoing effort as the inoculation campaign continues. Second, we have to have an adequate and ongoing supply of vaccine doses arriving through the federal government. This is absolutely critical. We can only work with what we've got. Thirdly, we need Albertans to sign up and to get the shot. We'll have the capacity to deliver, but we need as many people as possible to receive the vaccine. Last Thursday, I had a call with the Prime Minister and with other premiers across the country to discuss vaccine supply. And I conveyed to the Prime Minister, as well as have my colleagues, the urgency of getting as many doses delivered to our province as possible, as quickly as possible. The federal government signed exclusive contracts for Canadian supply of vaccines, so Alberta cannot legally procure its own separate supply, at least not with respect to the three vaccines currently being used globally, the Pfizer, Moderna, and AstraZeneca. We are not alone in our concerns about the supply of vaccine, especially as our pace of inoculation continues to pick up and there are millions of Albertans waiting their turn. In the meantime, my direction to Alberta's health system is clear: to create the fastest possible system for inoculation, driven by urgency despite the projected and current supply shortages. That's why we are here today. I'm pleased to announce that we are expanding our vaccine program even further than originally planned at this point. Starting right away, paramedics and emergency medical responders will also be eligible to receive the COVID-19 vaccines. Minister Chandra will go into further detail about this in a moment. we are now in a position where we can rapidly administer volumes well beyond what we are, in terms of the doses that we are currently being provided with. By the end of January, I'm confident that we'll have the capacity to administer about 50,000 doses per week, and we'll continue to increase our capacity, partly by partnering with pharmacies across the province. Our stretch goal is, for the end of March, is to be able to vaccinate up to 200,000 people per week. Of course, this is all dependent on the number of vaccine doses that we receive. In fact, based on the current schedule for expected new supply, we are set to effectively run out of vaccine doses about a week from now. Our plan to ramp up the rollout requires as well that we have a lineup of Albertans ready to get the vaccine. So far, we've built up a large group of eligible healthcare workers and seniors to vaccinate, and we'll only be adding more to those priority lists in the weeks to come. By expanding eligibility to paramedics and emergency medical technicians today, we and staff in COVID-19 units and medical surgical units last week, that's what we expanded it to last week, we are well on our way to get the those populations immunized. Plans to vaccinate Alberta seniors in the general population who are over the age of 75, as well as those in First Nations communities over the age of 65, will be announced very soon. And let me just add that the reason for the age differential there is that unfortunately we have seen significantly worse health outcomes from COVID-19 for people in our Indigenous and Métis communities. The bottom line is this: Alberta's capacity to give people the jab will soon outstrip available vaccine supplies, and we're doing everything humanly possible to roll out these life-saving vaccines as quickly as they arrive. So thank you, and I'd like to invite Minister Shandro to give you more details about the expanded eligibility for EMS, and then we'll be hearing from Dr. Hinshaw.
Thank you, Premier. Libby, are we okay to go? It looked like there was technical difficulty. You okay? Okay. Well, thank you, and good afternoon, everyone. As Premier noted, Alberta continues to be a national leader in vaccine rollout. The staff at the ministry, as well as at Alberta Health Services, have been working extremely hard. And over the past few weeks, we've administered, as of yesterday, as Premier said, over 47,000 vaccines to Albertans. Now, since the beginning, our vaccine program has been steadily rolling out, always with an eye to making sure that we are vaccinating those at highest risk first. In December, we started with high-priority healthcare workers in Edmonton and Calgary who could travel to the vaccine administration sites. Now, this was due to the strict limitations at the time in December that was put on the first shipments of vaccine by Pfizer. As we acquired more doses from and through the federal government, we expanded to start vaccinating priority healthcare workers across the province, and this included respiratory therapists, intensive care physicians and staff, long-term care and what we call here in Alberta designated supportive living facility staff in cities and towns in every zone. And look, our healthcare workers are there and have been throughout the pandemic there for us. They need to know that we're there for them. Now, right before the new year, our once vaccine could be safely transported to continuing care facilities, we expanded vaccination to residents in those facilities. And last week, we started giving the vaccine to healthcare workers in home care and emergency departments, and then expanded further to staff on COVID-19 units and med and surgical units as well in our hospitals and operating room staff just this past Friday. Now, each one of these steps has represented real progress and another opportunity to protect more Albertans from COVID. And as Premier just announced, today we are further expanding eligibility by making the vaccine available to paramedics and emergency medical responders as well. Paramedics are on the front line, first and foremost, as healthcare workers. They are a vital component of our COVID response, and I know that all paramedics are working day in and day out to keep Albertans safe. Our ground EMS brings emergency room level care directly to patients when they need it. And I know our air ambulance system is able to effectively function as a flying ICU. And I'm proud of Alberta's EMS and paramedicine system, and I'm so grateful for the work that you and all healthcare workers have provided throughout the pandemic to us as Albertans. Now, I know this news will be welcomed by our EMS colleagues, and I'm very pleased that we are in a position to add them to the Phase 1 rollout. This expansion of eligibility is important as we ramp up our efforts to get as many doses in the arms of healthcare workers as well as vulnerable Albertans as possible. Alberta Health Services will use their existing online booking system to arrange for the vaccination of these newly eligible healthcare workers. And I know there will be questions about when we can expect to see the rollout expanded even further here in Alberta. I ask that you be patient. We are waiting for additional vaccines to arrive. And I can appreciate the concerns everyone in the community has. My own parents are both in their 70s, but not yet 75. They're waiting like all of us at this time. But we all have and share a commitment to work as hard as possible to continue to ensure that vaccines get to Albertans as quickly as possible while ensuring safe and reliable delivery. The bottom line, we are here for you. We want every Albertan to get the vaccine as quickly as the federal government provides them to us. And I know we will be up here again very soon with even more updates on our progress because our work doesn't stop. Now for today, this expansion of eligibility to our EMS workers means that we can go even further in protecting our healthcare workers and those who are the most vulnerable among us. And we're ready. We are already administering vaccine in the evenings, on weekends, on holidays. Alberta has at least 69 vaccine clinics set up and working all across the province. And we'll add more as the vaccine and more vaccine becomes available to us through the federal government. We've also taken the vaccine to where people are, delivering it to long-term care and designated supported living sites, our DSL sites that I mentioned earlier, as well as setting up satellite clinics at hospitals. AHS is also working to make sure that these and future sites will be adequately staffed by actively hiring vaccinators. All of this is happening right now. We are doing exactly what we said we would do. We are taking care of Albertans. We are a model for the rest of Canada, and I could not be prouder of the work being done by both the folks in the ministry and those at AHS. Of course, these are important steps, but there are 4.4 million Albertans, which means we still have a long way to go. As most of us are awaiting our turn to get the vaccine, we can't relax our collective efforts now. So please continue to stay the course, abide by the public health restrictions. I know that it's been a long and difficult few months, but we can't stop until all of us are protected. And we are working as fast and as efficiently as we can to make sure that that is exactly what happens. Thank you, and now I'll ask Dusty Mishral from the Alberta Paramedic Association of Alberta to give remarks. So thank you very much, Dusty.
Thank you, Premier Kenney and Minister Shandro, for the opportunity to be here to speak today. Today's announcement provides hope for Albertans and the paramedics who have been out there working the front lines of healthcare. The Alberta Paramedics Association is pleased that this government recognizes their paramedics as a critical part of healthcare. I'd like to express my gratitude to Minister Shandro for always hearing our concerns and for working with paramedics to ensure that we are supported. Thank you, Minister, for recognizing the good work my members are doing to keep us all safe and healthy. In Alberta, paramedics are diverse across the healthcare sector, working in numerous areas not only within the EMS system of ground and air ambulance, but also within the communities and emergency rooms. In all their various roles, paramedics are frontline healthcare workers who are actively treating COVID-19 patients and treating the most vulnerable to COVID-19. Vaccinating paramedics ensures the stability of those critical healthcare services. The stability of these services gives us the ability to utilize paramedics in non-traditional ways to support the provincial pandemic response. On behalf of Alberta paramedics, I want to thank Minister Sandro and Premier Kenney for hearing our concerns and for acting on them. I'd also like to thank the Premier and the Minister for the leadership and public service they have shown throughout the pandemic. Alberta has led the country in responding to the pandemic, and Alberta's paramedics are proud to work with this government in the fight against COVID-19. Following this announcement, Alberta Health Services will be sending an email to all EMS staff with a link to sign up for a vaccination. I ask that every paramedic in Alberta immediately sign up upon receiving the email and book a vaccination as soon as possible. In closing, thank you again to Minister Sandro and Premier Kenney. It has been very productive working with this government, and I am optimistic for the future of paramedicine in Alberta. I look forward to continuing our productive working relationship with the provincial government on this and other initiatives. Thank you.
Dr. Hinshaw to come and give her daily update. Thank you, and good afternoon, everyone. Over the last 24 hours, we have identified 639 new cases of COVID-19 in the province and completed about 9,800 tests. That puts our current positivity rate at 6.1%. There are 811 people in hospital, including 130 who have been admitted to the ICU. Sadly, 23 new deaths were reported to us in the past 24 hours. My deepest condolences go to the family and friends of those individuals. Looking to schools, we will resume reporting on school cases later this week as students in all grades resumed in-person learning today. Our overall numbers underline the importance of the immunization program that is underway. I know that many are celebrating Alberta's progress distributing the vaccine, and rightly so. I also know that some have questions and even worries, as is normal with anything new. As I said in December, Canada has one of the most robust regulatory systems for new vaccines in the world. Health Canada moved quickly, but at the same time, there was rigorous testing and scrutiny applied to these vaccines as to any others. Clinical trials with tens of thousands of participants from multiple countries found no safety concerns with the vaccines we are administering. But we are not taking that for granted. As we do with all new vaccines, we are watching closely to ensure that if any safety signals emerge, we will be able to detect them immediately. Like all other provinces and territories, we are working closely with the Public Health Agency of Canada to monitor for adverse events. As the Premier and Minister noted, we have administered more than 46,000 doses of the vaccines. So far, we have reported 7 adverse events following immunization. These are any health problems that follow immunization. They are not necessarily caused by the vaccine, but if a health problem happens after an immunization, we want to know so we can evaluate it. Of the 7 events reported, most were minor, such as swollen lymph nodes, diarrhea, or a rash. There were 3 that involved an allergic reaction. None of these were determined to be anaphylactic reactions. However, as is our common practice, second doses are deferred until an allergy assessment determines whether a second dose is safe. Having a limited number of adverse events is common in any immunization program, including influenza and the pneumococcal vaccine. The current overall adverse event rate per 100,000 doses for COVID-19 vaccines is roughly comparable to the rate for pneumococcal vaccines, where 8 adverse events have been reported this year from just under 31,000 doses given. Allergic reactions can happen with any medication, vaccine, or even food. Being ready to respond to an allergic reaction is a critical part of every immunization program. It is why anyone who gets the COVID-19 vaccine is asked to stay under medical observation for a short time afterwards. We will continue to closely monitor and report adverse events, and what we have seen so far is consistent with what was reported in the vaccine trials. It is common to see side effects like fever or muscle aches after a vaccine, and this is a sign that the immune system is working to build antibodies. I believe the benefits of vaccines far outweigh any risks, and this vaccine will save lives. I commend the many healthcare workers who are leading this work across the province. We are making excellent progress, but this does not yet reduce the challenge that COVID-19 still poses to our health system and our public health. And it does not change the important role that we all must play in the coming days. Albertans can be proud of the way we have brought our numbers down over the last month, especially when we look at the increasing trends happening in some other jurisdictions. We have more to do, but we are bending the curve, and we must keep up this momentum in the days ahead. Thank you, and we're happy to answer your questions.
As always, I'll ask everyone on the line to please be brief and limit yourself to one question. Operator, can you please put through the first caller?
First is David Staples with the Edmonton Journal. Go ahead, David.
Hi, my question is to the Premier and Dr. Hinshaw. My understanding from the federal government is the federal government is going to have 6 million doses by the end of March. Alberta would get 700,000 doses. So I'm wondering if that's correct and if there's any chance those numbers will change. And if we get that percentage of doses in Alberta, 700,000 doses, which would be 350,000 people inoculated by the end of March, when will we start to see enough drop in hospitalizations and death counts that we can that will have a significant impact enough for us to be able to reopen society based on vaccination?
Thanks, David. Perhaps I'll start with the statistical question about anticipated doses, and then Dr. Hinshaw can talk about the expectation for reducing the mortality rate. You're right. Based on the information we've been given by the federal government to date, we would expect by the end of the week of March 29th to have received 677,000 doses of the Pfizer and Moderna. And those would primarily be coming in on the Pfizer side. Mind you, we are told to expect a very large shipment of 132,000 Moderna doses on the week of March 15th. But as I pointed out, our capacity by that point at the end of March will far, far outstrip the incoming supply. So in terms of what impact that could have on the case fatality rate, I'll turn it over to Dr. Hinshaw.
Thanks, Premier. And I think one of the challenges as we're trying to figure out at what point we will have sufficient people vaccinated to lift all of our public health measures is the ongoing research that's needed to understand whether the 2 vaccines that we currently have available are effective not only at preventing symptomatic infection, which is what the trials demonstrated, but whether they also prevent transmission to others from asymptomatic infection. And that's one of the things that we're watching closely and watching additional research to help us understand that. We know from some of the studies that have been done looking at how fast the virus spreads that there's an estimated roughly 70% of the population that needs to be immune before we would have what's called herd immunity. But what we don't know for sure is, for example, some of the new variants that are being detected that have an increased infectivity, whether that changes the proportion of the population. Having said that, I would anticipate that between the coverage that we will hopefully be able to get by the end of March, in addition to seeing hopefully again some ability to move some of our activities outdoors, that we will hopefully be able to start easing some of our measures in a progressive way. But for the moment, we have each other as our vaccine, and that is not going to change again until we see a larger proportion of the population able to access vaccines.
I'll just add one, I think, important point, David, that I know you understand, which is that receiving 680,000 doses does not mean 680,000 people who are fully inoculated, because these are both double dose protocols, of course. And starting, I believe, next week, we start administering second doses from the 4-week time period that's elapsed from primary inoculation. And so, we need, bottom line is, to start approaching anything like community immunity, we need a whole lot more doses, and we need them more quickly.
Operator, can you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. A question for the Premier. I know there's a lot of debate about whether the federal government handled the procurement correctly, in the previous months. But looking ahead, is there anything that you want from the federal government in terms of things they can be doing to get additional supply? Or are we essentially stuck with the situation that we're in, given the contracts we've got and the global demand for these vaccines?
Well, I've urged them, as have all the other premiers, to do everything they possibly can to expand supply. And I hope part of that will involve the fastest possible Health Canada consideration of and prospective approval of new vaccines. For example, I know the United Kingdom has approved the Oxford AstraZeneca vaccine, and Health Canada has not. Of course, we want Canada to maintain high standards, but this is, if there was ever an emergency, this is it. And I hope that they have Health Canada operating around the clock to ensure the fastest possible approval times. We are hopeful, of course, that there will be additional vaccines that complete their phase 3 trials and receive approval that get into the queue for inventory. And I know the federal government, I believe, has signed at least conditional contracts with, I think it's, apart from Pfizer, Moderna, and AstraZeneca, I believe it's 4 or 5 other producers. But there are other platforms out there, and I've asked our legal folks to look at whether, if the federal government is not going to procure other vaccines that go to market, whether provincial governments can do so on their own. We're prepared to go as long as it takes in terms of our investment in this, if we can accelerate more vaccines here in Alberta, because, as I say, very shortly our capacity to administer these vaccines will outstrip the projected supply.
Operator, can you please put through the next caller?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. I just want to get really clear on this, because there's a lot of numbers and what's happening in March and what's happening now and what's happening next week. So when it comes to vaccines, Premier, how concerned are you that because of the way Ottawa has handled this vaccine, getting the vaccine to Alberta, that there will come a time when Albertans are lined up, as you want them to be, lined up, ready to get the shot, and there won't be anything to give them? How likely is that a scenario?
Well, Rick, it's extremely likely. In fact, it's almost certain to happen next week unless we get a huge surprise shipment. So I hope I'm really, really clear about that. I'm looking at our numbers here. But next week, we're projecting to be short at least 20,000. It could be significantly more based on our pace of inoculation. So all I see is red on our projections from the week of January 18th to the week of March 29. The red represents a shortage of supply. So it is very significant. But I want to be clear, this is not a blame game, but we're just saying that Alberta's health system has stepped up in a big way here, and we need more doses. Bottom line, it's very simple.
Operator, can you please put through the next caller?
Next is Tom Vernon with Global News. Go ahead, Tom.
Hi, thanks for taking my question. I'm not sure if this is for the Premier or for Dr. Hinshaw, but we saw the World Health Organization suggest we could actually stretch out the date between doses with the Pfizer vaccine. With this potential shortage coming up, the red on the schedule, is there any conversation, does it have to be federal conversation, provincial conversation about looking at that measure?
Well, I don't know if Minister Shander would like to speak to that, because I do know that we have, I believe, in procuring these vaccines, there are certain contractual obligations that they be administered in a protocol that is directed by the pharmaceutical company. And in the case of Pfizer, that's once every 4 weeks. Do you know about it, whether we have any flexibility around that, Tyler?
Thank you, Premier. And I'll let Dr. Hinshaw provide further details. But yes, this is something that she and her colleagues at the Special Advisory Committee, which is a committee of the chief MOHs around the country, have been discussing, looking at the evidence about the efficacy of expanding the period of time between the first dose and the second dose. And right now there is no data, I understand, for beyond 42 days, but their focus is on making sure that if there is any stretch between a period of time for either the Pfizer or Moderna vaccines, that that those decisions are based on what's going to be most effective for those patients. But Dr. Hinshaw, do you mind giving us an update on the considerations that have been the conversations that have been had by the SAC and the efficacy of the delaying beyond the 21 days for Pfizer and Moderna?
Sure. Thank you, Minister. So what we know is that in both the Pfizer and the Moderna trials, the outside edge of when the second dose was administered was 42 days, which is likely why the World Health Organization indicated that in situations where there's vaccine scarcity and where there's high community transmission, in order to protect the most people possible, that extended interval could be considered. It is something that we brought last week to our Alberta Advisory Committee on Immunization to consider using that extended interval to be able to provide as many first doses as possible to Albertans in the coming weeks. One of the things that's really important, though, is that when an Albertan agrees to receive vaccine, that they go through an informed consent process. And so if that interval is changed, it will be changed going forward, and it will be something that as Albertans come forward to be immunized, the explanation will be provided to them about if that extended interval is implemented. They will have that opportunity to understand, again, the rationale for that. And again, the implementation really is to be able to provide additional vaccine and the protection that comes from a single dose of vaccine to more people in this context of scarce vaccine supply. So more information will be coming on that in the days ahead.
Operator, can you please put through the next caller?
Next is Chris Varco, Calgary Herald. Go ahead, Chris.
Hello, I have a question for the Premier and for Dr. Hinshaw. First for the Premier. Companies in the personal services industries are threatening to reopen, and in one case they have done so today, saying that there's no consistency with the province shutting them down and allowing retailers or registered massage therapists to open up. I'm wondering what you can tell me what the consequences will be, and if your government is considering allowing them to partially reopen with some new restrictions in place. That's my question for the Premier. For Dr. Hinshaw, what's your understanding of the risk and the number of cases of transmission that have come from the personal services industry, such as spas or hair salons or gyms, in the last 9 or 10 months?
Well, thanks for the question. First of all, I know this is just a brutally difficult time for those personal services businesses. Many of them are small owner-operator businesses where it's often the only source of income in that household, and everything is tied up in those small businesses. And I also acknowledge that so many of those businesses, hairdressers and estheticians and so many others have non-therapeutic massage, for example, they have taken great precaution to operate safely throughout COVID. Now, having said that, I want to take us back to where we were about 5 weeks ago, when we were in the midst of what was, quite frankly, a frightening exponential growth in COVID in Alberta that was causing enormous stress on our healthcare system. And if we had not taken firm measures in November, December, it's clear to me that we would not have just had 950 people with COVID in hospital and approaching 200 in ICUs, but that could have doubled and doubled again, which would have completely overwhelmed the healthcare system. As I've said, our government's approach has been to use restrictions as a last and limited measure because we do recognize the damaging impact that they have. Now, I do understand that people see any restriction as being arbitrary. I mean, everybody wants, it seems quite obviously and quite rationally, they want their area of activity, of economic or social activity to open up. But we had to look at, basically what we had to do was just reduce overall social contact. And we will be looking at the data once the numbers stabilize from the dip in testing over the Christmas holidays. And in a couple of weeks, we'll be coming back to look at that. And my heart truly goes out to those folks in the personal services businesses. In terms of what exactly has driven the policy with respect to their restrictions, I'll defer to Dr. Hinshaw.
Thank you, Premier. I would echo what the Premier has said in terms of recognizing that the restrictions in place are a significant burden to many, and also the point that the operators of those businesses and people who work in those businesses worked very hard over the summer and fall to make those safe places. So when we were able to follow up with all of our cases, we didn't see significant transmission happening in the context of relatively low community transmission. But there are two things that we don't know from the period of time in November and December when we had very, very high cases. First of all, given the extremely rapid growth of cases, we were not able to follow up with many people in November and December, so we simply don't know where they acquired the infection. And the second thing we don't know is whether or not the precautions that seemed to be effective, again, in the earlier months, with the significant spike in community transmission, whether that would have put enough pressure onto those businesses where they would have seen transmission. And right now, we know, for example, you'd mentioned gyms in your list, and I would say that we do know that group activity and group fitness has been a source of transmission. We have seen transmission in some gyms. I know that the fitness industry has, again, gone to great lengths to make their businesses safe. And as we continue to look at the data, we will hopefully be able to look at potentially easing measures, but the best way to be able to open these businesses again is for all of us to work together to bring our numbers down.
I'll just add one more comment on this, which is, despite all of this, Alberta continues in almost every area to have the least stringent restrictions in the country. So I think that reflects our effort to find a balance here. We have other provinces bringing in curfews now that have shut down virtually all retail businesses, far larger portions of their economies. We've tried to be targeted in our approach, given the critical situation in November and December.
Okay, we have time for 3 more. Operator, can you put through the next caller, please?
Next is Carly Robinson with City News Edmonton. Go ahead, Carly.
Can you hear? Hello? Sorry. Hi, I'm hoping to get the Premier's perspective on new polling data from Angus Reid that shows Albertans are amongst the most vaccine hesitant, 20% saying they don't want the vaccine at all. What's Alberta going to do to improve perception of vaccines?
Educate the public, and that's what we're doing today. Dr. Hinshaw spoke at length about the safety of these vaccines. That's a message we need to get out there, that we've administered almost 50,000 with only 7 adverse events, and these are not serious adverse reactions to the vaccine. So we're talking, so far in this province, with nearly 50,000 administered, 99.99% that have happened without an adverse event. So that's, I think, there's a big chunk of the public. Look, let me just back up to say, as you know, there's always an element in the public who are anti-vaccine generally and who are skeptical about vaccines. And quite frankly, for those who are hardcore committed to that position, and I've tried to interface with them on Facebook and elsewhere, I think that's a group that is almost impossible to persuade. The group that we really need to focus on is in the middle. It's people who are saying they want to wait. They're not ready to do this yet, but I think they're taking a wait and see approach. And I understand that. These are people who take their health, they're very careful about their health, and they don't want to rush into taking a vaccine that they believe has not yet been fully proven through widespread applications. I think those folks, they're going to watch and wait and see, and they're going to see that these numbers continue with 99.99% not creating adverse effects. So those people it'll take some time, I think, to get their confidence in this. And I think that they will see the value of this over the months to come. Let's not forget that we really, based on our current access to vaccines, it's not going to be well into the second half of 2021 when we're the broad general population is getting vaccinated in very large numbers. So I think the wait and see folks, they'll have time to wait and to see that this is safe. We were already, of course, using government advertising resources to promote the vaccination program. And I guess what I would say to those folks who are skeptical is, if you're frustrated with COVID, with the restrictions, with being unable to visit family members, with all of the anxiety, the best thing you can do is to get vaccinated. Of course, stay safe and observe the public health rules, but also to get vaccinated. I don't know, Tyler, do you want to say something about that?
Thank you, Premier. And just to supplement that, to use this as an opportunity as well, to point out that part of the solution in Alberta is going to be, and this is one of the reasons why we saw an increased uptake in Alberta for the seasonal flu vaccine, to give a shout out to our pharmacists, that to have one of the most progressive, actually the most progressive scope of practice in all of Canada for our pharmacists, allows Alberta to have folks in the community be able to walk us through and talk about the safety and the efficacy of a vaccine, and how it's not even just important for us to protect our own health and our own well-being, but to protect those who are the most vulnerable. I mentioned earlier today, my parents being in their 70s, I take the seasonal flu vaccine, and I'm going to take the COVID vaccine for them. We have 2 newborns in my extended family, and I'm going to continue to take seasonal flu vaccines for them. And having those pharmacists walk through and talk about the safety and the efficacy is going to be part of the solution as well for us here in Alberta.
Operator, can you please put through the next caller?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. I have a question for Dr. Hinshaw and one for the Premier. First, how many times has the AB Trace Together app been used to trace a case of COVID-19? And the Stoney Nakoda Nation has declared a local state of emergency due to rising cases of COVID-19. What's being done to help this and other Indigenous communities in Alberta?
I'll take the first question with respect to the AB Trace Together app. And I haven't seen the most recent data on how many cases we've used the app for, but that's certainly something we can look into and get back to. We know that the app is most effective when we have many people in the public who have downloaded it so that it can provide us with that information. We know that our contact tracing is increasing in its effectiveness at reaching our cases in a timely way. And so I anticipate that our numbers will be increasing. We have been working very closely with Singapore, which is the country who developed the app in the first place, and we've been learning a lot from them. They have a large proportion of their population who have downloaded the app, and it's been an incredibly effective tool for them. And so we're working to understand how we can best use this functionality. And again, reminding people that it does work best when most of us have this as an app we download on our phone so that it can notify us if we are in close contact with somebody who was infectious.
Yeah, no, I would just add to that, Kevin, that there were updates to the app in December. There will be more updates in January, so it's increasing in terms of its operational effectiveness, and we hope that after the January updates are done, to put another push on that to get people to download it. But more people are joining every day and every week, and we do appreciate that. With respect to the Stony Nakoda, I haven't been in touch with the chief there myself directly, but I do know that Indigenous Relations Minister Rick Wilson is in daily contact with First Nations chiefs on COVID, and there's been actually really very strong collaboration between Alberta Public Health, AHS, and the First Nations across the province. They took this very seriously from day one, partly because their communities have very sad memories about pandemics in the past. And unfortunately, in the last month or so, we have seen a worrisome increase in the number of new and active cases on many reserves. In fact, in all parts of the province. And this is a very serious concern. In some cases, we've heard that there may have been large numbers of people gathering at wakes following funerals, not in compliance with the Alberta health restrictions. And so wherever those things, people need to understand that events like that can become super spreader events. Secondly, as you know, unfortunately, many of our Indigenous people live in low-income circumstances with high-density housing and have challenges with self-isolation. And so I would repeat to those nations that they are eligible as well. I should say that the support for self-isolation is for people who live in Calgary and Edmonton, but if they need it, we can expand that to provide free hotel rooms and self-isolation support if they have people who, because of crowded housing situations, are not able to effectively self-isolate at home. So there's a whole bunch of supports that are available, and I'm sure that Minister Wilson is working already with Chief Aaron Young at the Stony Nakoda First Nation on their declaration of emergency.
Operator, can you please put through our final question?
Final question is Audrey Neveu with Radio Canada. Go ahead, Audrey.
Hi, I got a question for Dr. Hinshaw. With the 46,000 plus doses administered, what percentage does that amount to of all the doses that we had? And I have a question for Premier Kenney, just a repeat of an English question that was asked earlier on vaccine hesitation. Monsieur le Premier ministre, on a vu donc dans un sondage Angus Reid que moins d'Albertains sont enclins à se faire vacciner tout de suite que le reste des Canadiens. Quelles sont les raisons pour cette hésitation selon vous?
Doctor, go ahead.
Thank you for that. The statistics that I saw this morning we're sitting at approximately 80% of the received vaccine. We can get you the specific number after the availability, but that's the metric that I saw this morning.
Et je dirais que, évidemment, il y a un noyau dans la population qui sont sceptiques envers tous les vaccins. C'est difficile à convaincre ces personnes-là d'avoir le vaccin de COVID-19. Cela étant dit, le cible est un groupe de la population qui est ouverte à l'idée d'une inoculation, mais qui veut attendre et voir l'efficacité et la sûreté de ce vaccin. Et ça sera plusieurs mois pour ces gens-là à voir la sûreté ils sont les vaccins qui ne menacent pas, ne posent pas de menace envers leur santé. Effectivement, nous voyons que jusque maintenant, avec presque 50 000 Albertans qui ont reçu les vaccins de COVID-19, seulement 7 de ces personnes-là ont vécu une réponse négative. Ça veut dire que 99,99% qui ont reçu le vaccin n'ont pas eu une réponse négative. Alors, on va partager ces données-là avec les gens qui attendent pour voir les réponses et je crois que je suis optimiste que nous pouvons voir au moins 3/4 de la population albertaine qui, cette année, recevront les vaccins.
Okay, we'll leave it there for today. Dr. Hinshaw will be back with another update tomorrow afternoon. Have a good night, everyone.